A viewer says, I have a stabbing pain near my clitoris that started after having sex with my boyfriend. What is wrong, Dr. Leah?
Well, let's start with understanding this part of the body because this type of pain can mean different things. The external clitoris, or the glans clitoris, is covered by the clitoral hood, where your inner labia meet at the top. There are a lot of nervings there, which can make it feel sensitive. Touching and stimulating the clitoris can lead to sexual arousal and orgasm. However, when the clitoris hurts, it can be frustrating.
And what are those different types of pains?
Well, clitoral pain can vary in severity and frequency. It might feel like a sharp or mildly uncomfortable. It could occur occasionally or persistently and worsen with touch, certain movements, or tight clothing. You may also notice a bump or swelling on the clitoris. If these symptoms sound familiar, consider speaking with your doctor.
So you mentioned, let's say, tight clothing. Is there anything else that might cause the pain?
Well, the pain could stem from issues with the clitoris itself or referred pain from other parts of the vulva. There is something called keratin pearls, which is the buildup of the glandular secretions, and this is like a grain-like substance. This can cause the clitoral hood to adhere to the clitoris, which leads to pain and inflammation. There are operations that can remove these. Some dermatological conditions could be the cause. Anything from allergic reactions, eczema, or psoriasis can cause pain here. Creams and at-home treatments usually work for those.
Okay. I'm sure there's other causes of pain. What else can cause pain?
Well, trauma can cause pain. This includes trauma from giving birth, pelvic surgery, or even aggressive sex, or the use of toys. Sometimes home treatments like hot or cold pads help, along with the over-the-counter pain relievers. Then there are several conditions like yeast infections, STDs, PCOS, and UTIs, just to name a few. You're gonna definitely want to treat those directly. A lot of these conditions can be generally uncomfortable, and many of them are quite common. For some tips on how to treat yeast infections, take a look at this.
If you've ever had a vaginal yeast infection, you know how uncomfortable it can be. Here are the 5 do's and don'ts for treating it. Number 1, your doctor can prescribe a pill called fluconazole, which can treat most yeast infections with just 1 dose, although symptoms may take a few days to disappear. If you are unable to take a pill, or you might be pregnant, your doctor may prescribe a 3 or 7-day treatment of turconazole, an antifungal vaginal cream. Number 2, if you'd rather try an over-the-counter treatment first, miconazole is a topical antifungal cream available in 1, 3, and 7-day options. It's a little messy, but pretty quick to bring relief, often faster than the prescription pill. Keep in mind, however, that there are all different types of yeast. The best way to make sure you're treating your infection in the most effective way is to talk with your doctor first. Number 3, don't put yogurt down there. While eating yogurt is a healthy source of probiotics, live bacteria, and yeast that are good for you, applying yogurt topically to the vulva or inserting it into the vagina does nothing to make the yeast infection go away. In fact, the natural sugars in yogurt, even the unsweetened kind, can actually fuel yeast growth and make matters even worse. Number 4, don't sit in vinegar. Vinegar is not your friend, at least when it comes to curing a yeast infection. Contrary to popular thought, there is little evidence that sitting in a vinegar bath reduces vaginal pH. It actually can be painful, causing more burning or irritation. Needless to say, old-fashioned vinegar douches are also a big no-no. They can disrupt natural healthy bacteria and increase the risk of infection. Number 5, don't make your treatment a DIY project. Just like yogurt and vinegar, there are a number of other home remedies floating around the internet that are best to avoid. Applying tea tree oil, coconut oil, or garlic topically, or inserting any of them into the vagina with a suppository, are just a few of the home remedies that have not been proven to treat a yeast infection. And like vinegar, they can cause burning and more irritation. Yeast infections are no fun. If you get them frequently, or if the recommended treatments don't seem to help, it's important to call your doctor to determine the underlying cause.